Come in.
Hey, I am Chanel Johnson. I am going to be your nurse practitioner today. I'm just going to close the door to provide us some privacy and wash my hands really quickly, okay?
That'd be fantastic.
Okay. Close the door, set this down, and wash my hands. How you feeling today?
I feel good.
Good, good. And can I get your name and date of birth?
My name is Cedric Bass. Make something up. Date of birth is 5/26/73.
Awesome. And again, I am Chanel Johnson. I'm going to be your nurse practitioner today. It is a pleasure to meet you, Mr. Bass. And I understand that you had an incident at work where something kind of fell and hit you on the head. Can you tell me a little bit about that?
Well, yeah, there were some things loose in the ceiling and, just got a little bump on the head, nothing major.
All right, got you. So since you came in today and had that something hit you on the head, we are going to do a physical assessment just to kind of check everything out and make sure everything's okay. Then we're going to do a mental status exam. And that's just to kind of make sure that there's no mood changes or cognition changes that might have happened as a result of getting hit on the head. Is that okay?
It works.
All right, awesome. And so I am going to be talking out loud as I'm doing some of this. Since this is a video for class, I do have to explain some of the procedures out loud as well versus just going through them. So don't mind me when I'm talking, and if you have any questions, definitely feel free to ask. And the first thing I'm doing upon my assessment is just kind of noticing just your overall apparent state of being. You don't see any signs of malnourishment. You don't look dehydrated. You are dressed appropriately. Your hygiene seems pretty appropriate. I don't notice any body odor, any breath odor, anything of that nature. You seem to be of regular stature and pretty fit for your age. Do you know where you are?
Yes.
Where are we?
I'm in your doctor's office.
Awesome. And what's today's date?
Today is June 3rd, 2026.
All right. And what are you here for?
I'm here because I had an incident at work.
All right. Awesome. So you are alert and oriented to your person, the place that you are, the time that it is, and you have situational awareness as well. So we call that alert and oriented. I also don't notice any signs of distress on you. I don't see like you struggling to breathe. There's no intercostal muscles working hard, no stomach breathing. You aren't holding your chest, so there's no signs of like anything going on with your heart. I don't see you wincing or anything like that in pain, so none of those things are apparent. And your facial expression so far seem pretty congruent with the things that we're talking about. I don't see any signs of sadness, any signs of anxiety, anything like that. So those are just some of the apparent things that I noticed. And so we're going to go and move on towards your vital signs. Can I get your height and weight, Mr. Bass?
I'm about 210
Okay.
and about 5'10" as well.
Okay, 5'10" and 210. Okay. Then you have pretty normal stature and build for your age and size, so that's cool. So next thing we're going to move on to is I'm going to take your temperature via forehead thermometer. We call that the temporal artery thermometer. And so your temperature here. And your temperature is 97.3 via temporal artery thermometer, which is in the normal range. And the next thing I'm going to do is I am going to take your pulse. And in order to do that, I'm just going to take your radial pulse here. And I'm just going to kind of notice the rhythm. Because if it's normal, then I'm just going to count it for 15 seconds and multiply that by 4 to get your beats per minute. And you do have a pretty normal rhythm. So I'm going to go ahead and start that count now. Okay. And that was 12. And when we times that by 4, we get 48. That's too low. I'm going to have to take that again. Let me try that one more time. That's a little low. And sometimes when people are athletic, they do have low pulses. So here we go. All right, here we go. So got 16 times 4, which will give us a rate of 64 beats per minute, which is normal. And again, that you do have a normal rhythm as well. And then I am just going to take your respirations here. So I just want you to breathe normally. Normally, I wouldn't tell you that I was taking your respirations, but since we're in the video, I am going to let you know that that is what's happening. And I'm just going to, if you have a normal rhythm, to take that for 30 seconds. And then times it by 2 to get your number of respirations per minute. If it's not a normal rhythm, then I'll just take it for the whole minute, okay? All right, so here we go. I'm gonna place my hand right here, so okay?
Yes.
All right, and that is 7 times 2, which is give us 14 breaths per minute. It's a little low. Do you tend to breathe slower? Do you do like exercises and things like that to slow down your breathing sometimes?
Yes.
Okay, okay. Yeah, and do you play sports at all or anything like that?
Yes.
Okay, so those things will keep your respiratory rate low as well as your resting heart rate low as well. Okay, and I didn't notice any issues with breathing or anything like that. Your depth was normal. You seem to breathe with ease, so everything seems okay there. Next step is going to be to take your blood pressure. And because you're a new client, I am going to take that on both arms. Okay. So, let's see here. Just check your arm and make sure there's nothing here that indicates that I shouldn't be taking your blood pressure there. And for your radial pulse, I want to make sure that this fits. I'm sorry, your brachial, and make sure that this fits. That is a good size for you, and we do want to make sure that it's the appropriate size. And you always want to make sure when somebody's taking your blood pressure that it's the appropriate size cup, because if not, then the blood pressure reading will not be accurate. Okay, and so the first thing I'm going to do is I am going to feel for your brachial pulse, and then I'm going to blow the cup up until that stops. And that's going to give me an estimate of what your systolic pressure is. And I'm going to add 30 to that, and then I'm going to blow it all the way up to 30, plus that number, and then we'll start taking your blood pressure. All right, and that was 140 for you. So I'm going to release and add 30 to that. So when I blow it back up, I'm going to blow it up to 170. All right, 118 over 76, which is normal. It's actually pretty low for your age as well. So you are doing whatever you're doing to take care of yourself. You keep it up, Mr. Bass. All right, and I'm gonna do the other arm as well. Again, since you're a new patient, we just want to make sure that we have a good baseline on what your blood pressure actually is. Okay. So check out that. All right. feel that stop at 120. So I'm gonna go up to 150, even though we know you're probably a lot lower than that. On 20 over 78. Alright, so you're going to take it normal. It's like textbook.
Of course.
Alright, and how you feeling so far?
Feel good.
Good. So we've gotten the physical portion of the exam done. Now we're going to move on to the mental status exam. Again, this is just to kind of test like your cognition and things like that and make sure that, you know, that bump on the head didn't cause any damage or anything that we need to look further into. Cool beans?
Cool beans.
Alright, and again, we already know that your general appearance is pretty cool. You said that you had a bump. When did the accident happen?
Earlier today.
Earlier today. Alright. So it's a little, is it okay if I touch?
Mm-hmm.
Alright. And a little right there. But, you know, the swelling isn't too bad. You put ice on it?
Yes.
Okay. Awesome. And your vital signs are all normal. They're actually great. We already assessed your level of consciousness. You are alert and aware. We already assessed your posture. I don't notice anything psychomotor activity-wise, like no tics, no uncontrollable movements, no shaking, anything of that nature. We did say that your personal hygiene is great. You're dressed appropriately. You're groomed well. Your facial expressions are congruent with, you know, the things that we're talking about and things of that nature. Your affect is congruent, and you seem to be pretty aware of where you are in relation to things and things of that nature. Tell me a little bit more about the work that you do.
I do IT work,
Okay.
infrastructure, yes.
Okay. Were you going in the ceiling when it hit you on the head?
Yes.
Or okay, is this the first time that this has happened?
Yes.
Okay. Have you had any other incidents at work?
No.
Okay. And about how long ago did this happen? What time did this happen?
Oh, this happened this morning at about 10:30 a.m.
Okay, cool. And so your speech seems to be pretty fluent at a normal rate. You're using an appropriate amount of words. That's typical. You're articulating your words pretty well. I don't see any need to evaluate for aphasia. Sometimes when there is damage to our brains, it can kind of affect our ability to produce words, to either sound them out or to remember what they are and things of that nature. And we don't see any issues with that so far. Your mood seems pretty calm and stable from what I can see being here. Have you noticed any increased anger, irritation, sleepiness, sadness, elation, anything that feels out of the normal for yourself since this incident happened?
No.
All right, so your mood and affect are stable and congruent. All right, and your thought process seems pretty logical. Seems like you got hit in the head. You're like, oh, let me go to the doctor and find out what's going on. What's your normal day-to-day like? Like, what's your normal routine?
As far as, you know, getting up in the morning,
Mm-hmm.
you know, regular hygiene, shower, wash my face, brush my teeth, all of that good stuff.
Okay.
Eat something and head out to work.
Okay, and about how many hours a day do you typically work?
Typically work standard 8 hours.
Okay, cool. And then how many days a week do you work?
Typically 5, sometimes more.
Okay, so it seems like you are aware of the sequence of things and aware of the order of the day. You know what a typical work day is and how those things go. So not worried about any cognitive issues there. Have you noticed since the incident, have you heard anything that maybe other people don't hear, saw anything that other people don't see, feel any delusions at all or anything like that?
No.
All right, so I'm going to say there are no apparent signs of hallucinations or delusions. It seems like you have pretty good insight and judgment. Your head got hit, you decided to come to the doctor and check it out. So we're going to say that your judgment is intact and your insight is appropriate. You are oriented to time, place, and person, as we talked about before. So now we're just going to do a couple more tests just to kind of make sure that there's not any apparent brain damage on the surface. So I'm going to tell you 4 numbers, and I just want you to repeat them back to me. Ready?
Okay.
3, 8, 1, and 4.
Okay.
And what are those 4 numbers?
3, 8, 1, and 4.
All right, I got something a little more challenging. You ready?
Yes.
The IT guy, you might have, I think you don't struggle with numbers, but we're just going to check it out and see. 5, 2, 7, and 6, but I want you to repeat them backwards. So I'm going to say 5, 2, 7, 6. Backwards, you say?
6, 7, 2, 5.
Awesome. All right, and we're going to start at 100. I want you to count backwards, subtracting 7.
Starting at 100.
Yes.
Subtracting 7.
Yes, sir.
We got 93. We got 86. We got 79. We got 63. No, hold on. 79, 73. Then we're cycling back through 66 and 59. Is my math bad?
A little bit.
A little bit.
Let's start over. Okay?
Start over, okay.
Yes, let's start at 100.
Start at 100.
It's okay. You can go back
Okay.
7.
93.
Mm-hmm.
Okay. 86.
Mm-hmm.
Okay. From 86 we go to 79.
Yep.
Okay. Then we go to 72. Oh, that's where I messed up. Okay. 72. Then we got 65.
All right. Cool.
Okay.
Got you.
Okay.
And can you spell the word world backwards for me?
World.
Yes.
Okay. DLROW.
Awesome. Do you have any children?
Yes.
Okay. Can you tell me your oldest child's birth date?
Yes. 9/24/2002.
Okay. And what was the weather like today?
The weather was sunny and warm. Sunny and hot, I should say.
Okay. So it looks like we don't have any problems with remote memory. Remember your oldest child's birthday. Recent memory. Remembering today's weather. All right. So I'm going to give you 3 words. Then I'm going to give you a task. And then I'm going to ask you what those 3 words are. You
Okay.
ready?
Mm-hmm.
All right. So my 3 words are ball, chair, truck.
Okay.
Ball, chair, truck. Okay. Can you draw the face of a clock for me with its components?
Sure. Any particular time?
No, it's your world, Mr. Bass. Whatever time you want it to be.
Okay.
Awesome. Do you remember our 3 words?
Chair, ball, truck.
Awesome, awesome. And you do have all of the components of a clock here, so that's good. We got that part intact. It seems like when it comes to information, vocabulary, those things are intact. You've been talking about IT, infrastructure, things of that nature. You've been able to talk about your day. You've been able to remember words. And now I have some more math for you. You know, IT people like math, so.
Okay.
How is your addition, subtraction, multiplication, and division? Okay.
So,
All right. What is 5 plus 7
12
minus 3
is minus 3 is 9.
times 4
Times 4 is 9 times 4 is 36.
plus 4
40.
divided by 10?
4.
All right. Awesome. So we got your calculating ability is still intact. For abstract thinking, what does it mean that you can't have your cake and eat it too?
Just like it says, you can't have something and consume it at the same time. You consume it is inherently gone. So, yeah.
Okay, awesome. And what does it mean that a bird in a hand is better than 3 eggs in a basket?
I'm not familiar with that saying. But, to have have something is better than to, see something over there. Just the presence of something is better.
Okay, awesome. And can you tell me how an orange and an apple are similar?
They're both fruits.
Okay, can you tell me how they're different?
One is orange and one is typically red.
Okay, awesome. So similarities are intact, ability to think higher about proverbs and sayings are intact. You were able to construct a clock, so your ability to construct is intact. So as far as the mental status exam goes, everything seems to be intact and okay there. If you notice any growing irritation, any growing sleepiness, tiredness, anything that just doesn't feel right or you don't feel like yourself, definitely come back and let us know. But right now, everything checks out and looks good, okay?
Okay.
All right, thank you so much, Mr. Bash. You have any questions for me before I go?
No, I don't.
All right, it was a pleasure meeting you. Again, my name is Chanel Johnson. I was your nurse practitioner today, and definitely give us a call back if you have any questions, okay?
Okay.
All right, thank you.